Welcome to Skinside Out, where we uncover the science, trends, and truths behind skin health. Your trusted guide to the world of dermatology. This podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional.
Welcome to Skinside Out, where science meets beauty. I'm your host, Dr. Zain, with Heather, Courtney, and Nurse Wendy. She's back. We didn't scare her off. So today we're going to be discussing, continuing our discussion on the biopsychosocial model and a condition that we don't often talk about, but it is really important and related to dermatology. That's body dysmorphic disorder. So we're going to be talking about that in more depth and how it intersects with our practice.
Yeah, so we're going to talk about the psychological impact that it has on our patients, recognizing body dysmorphia within our patient clientele, and its role in dermatology, the role we play in it, and collaborating and working with other providers on how to treat this.
Yeah.
So what is body dysmorphia?
So body dysmorphia is a mental health disorder where individuals are super fixated on how they appear. So they are perceiving flaws in their appearance that, are often really minor to the average eye, but they can be all-consuming for these patients.
In dermatology, this manifests as someone who is heavily focused on their skin, whether it's acne, blemishes, scars, or even just imagined imperfections that aren't necessarily visible or maybe very mild.
I feel like it's important to note, too, that I feel like we all go through times where maybe we have a pimple and, we're obsessive over that for those moments. So that's normal. But we're talking about people who are consistently finding flaws within themselves.
And affecting your quality of life, like all consuming.
Exactly.
So what are the impacts that we see on, the individual?
People who have this typically will experience heightened anxiety. They might not want to go out or do certain things if they feel that they look a certain way or will be perceived a certain way. So it can impact your sense of self-worth. It can affect you as far as things like depression go. Again, just limiting things that you would otherwise normally do. So it's kind of all tied back to those perceived flaws.
Yeah, and that psychological impact can lead to, constant worrying or attempts to try to fix these perceived imperfections. And so in dermatology, it's not, our job isn't just to treat the skin. It's really to recognize when a patient's concerns go beyond physical appearance.
And patients with body dysmorphia, they often come back time after time after time, and they are getting the same treatment over and over again, and they're just not satisfied with the results. So for us, it's very discouraging because, we want to make everybody happy. We want them to feel good about themselves. And with this, it's something within them that needs to be treated, not on the surface level.
An example that comes to mind is, like the human Barbie doll and the human Ken doll. Like these are people who have undergone so many plastic surgery procedures to essentially look like Barbie and Ken. And it almost distorts their features and doesn't make them even look human. And it's kind of sad because, I'm sure that they were very attractive people to begin with. And they just kept doing more and more and more, and they can't get out of that cycle.
Well, and I think, unfortunately, the role that social media has played in this has really amplified this because, especially you think back to Snapchat where the filters, and then now TikTok, you have the clear skin filter, which obviously removes every imperfection. You have, filters that change the shape of your face, things that, we didn't really we weren't constantly looking at each other before social media. And so I think it has really amplified. You see all these other people, but you don't know, are they using Facetune? Are they using a filter? So it's really hard to, tell people that, to separate out reality from what's fake.
Yeah, I think not only social media too, but also just society in general. I think plays a big role in this, especially for young females. I mean, we are so overly mindful of the way that our bodies look and our skin looks. I know when I was growing up, I was in high school, and I, had those insecurities. And I even, crazy story, I went down the rabbit hole of like finding different models that I liked the look of in magazines, cut out their pictures, put it all on a big poster, and hung it in my closet at the mirror. And so it's like, I wouldn't necessarily say that, I mean, I wasn't ever diagnosed with body dysmorphia or body dysmorphic disorder, but I had that sense of, I want to look like them. I don't want to look how I look. I want that look.
Yeah, and as a dad of 3 girls, I am constantly figuring out ways to kind of connect with them, to let them know that they're beautiful the way that they are, and they really are. They're beautiful girls, and it breaks my heart when I hear things like, "Oh, someone at school told me that I look like I don't look pretty, or like I look hairy, or." Like my teeth look funny, things like that. And I just really feel so bad for a lot of these young women, young girls who are constantly bombarded with these images of perfection, and then also these comments from others about their bodies. And I don't think that is fair. I think it's damaging for self-esteem, and it's not solicited. So like, you mind your own business. Like, that's what I tell them. Like, you mind your own business. Don't talk about my body. That is personal.
Yeah. And at the end of the day, time and time again, you don't know what's going on in someone's life. So no one is perfect. No one is always, and we always joke about this. We work in the industry. We get pimples. We have wrinkles. Like we get it all. So no one is perfect. And so it's figuring out your comfort level and being mindful of that.
To add on to that, just body dysmorphia, but also things like anorexia. I mean, I did gymnastics my whole life, and unfortunately saw a lot of that. And I think, you have to be careful what you're saying to people. People might take something a different way. I was called thunder thighs once, and
that's crazy. Heather is tiny.
But yeah, I mean, that person who told me that probably doesn't remember saying it, but I've remembered it ever since.
Yeah.
We did
words cut deeply. Cut really deep.
We did, when I was a camp counselor, this exercise where we folded up a sheet of paper for the kids to show them that so each insult we would crinkle up the paper. Then at the end we would unfold the paper and show them, okay, these are your words. They're still impactful, even though you've let them go. Like the paper still has them.
Oh, that's cool.
Yeah, I think the kids really were able to visualize that.
Yeah, and it also affects men. So I remember in high school, like I was super thin, like I played soccer, I was a runner, and I was just really thin, and I was always really self-conscious about that. So like, then I started hitting the weights, and started like taking whey protein supplements, things like that, to kind of build up my body so I can look like the other guys. And it does weigh on you. And men also kind of have these stereotypical images that bombard them, that this is how you should look. You should all like be like really muscular and lean, and should be acting a certain way. So it does affect men too.
Yeah. So how do you guys as providers recognize that in patients that you're treating?
Yeah, that's a good question. So I think it starts with the consult and just kind of listening to the patient. So I really always start my consults with asking the patient what they see in the mirror. And if I'm seeing a huge disconnect between what I'm seeing and what the patient is seeing, and then just a very skewed vision of what they see as wrong with their bodies, their faces, then that's a red flag. Then I kind of delve a little bit deeper. Okay, so why do you think this, and what have you done in the past, and how do you think this can be improved, things like that, and kind of probe a little deeper.
Yeah, I think it's definitely a challenge, though. It's not an easy topic to talk about and bring up. But I think it's really just kind of finding that balance between treating the skin and acknowledging the psychological impact of the condition.
Sometimes their expectations are just way off the charts. And, I mean, when they come in with beautiful high cheekbones and they want more and more and more, that, then you're going to start morphing yourself into looking like not yourself. So, so that's, you got to kind of find the common ground. And then they start letting you know about all the treatments that they've had, because sometimes they hold all that in at first. So you build up that rapport with them and then they kind of let everything out and you can, tell that they've been on this journey for a while.
And another red flag, they doctor hop.
Yes.
They go from office to office to office. They're never happy with their results, and they talk poorly about another physician or provider, and that also kind of raises my red flag.
Yeah, and that's where it's so important for providers to have the understanding of that and not just treat. I think there are providers out there, unfortunately, the reality of it is that don't care about that and basically use that to their advantage financially. They see someone that's willing to spend money and do all of these treatments that they might not necessarily need. Yeah. And so they're really a victim of that situation.
And remember, as physicians, we took an oath, do no harm. And this can harm patients mentally, physically. So it's really important to carefully navigate these discussions. And honestly, if I have a feeling that a patient has body dysmorphia, I try in a tactful way to try to bow out.
And you're so good about saying you're beautiful. You've got great structure, and so you, no matter what our patients are coming in for, you always accentuate their highlights and let them know that they are beautiful, and they are. So, I think that's very important.
Yeah.
And I think some procedures can be better utilized than others. For example, I had a patient I saw at my last practice. She was a young woman in her late 30s, and she constantly was concerned about her pores, or she would point out the tiniest little start of a freckle.
Or they come in with a magnifier.
I forget rid of the magnifier.
The big pictures.
We don't need those magnifying mirrors.
No one has eyes that magnetize things, so you do not need to look in that mirror and assume that's what people are seeing. No one is looking that close, and if they are, they better be buying you dinner. But she just constantly was going after things. And so in that scenario, I don't mind doing things that I know are not harmful, such as microneedling, where, okay, we'll do the microneedling monthly. You'll still reap the benefits of that, but it's not something disfiguring. Right. Whereas, there are things like the filler or tox that you're overdoing it and can really disfigure that person.
Yeah, and I think just as professionals, it's essential to approach these situations with sensitivity, empathy, and in some cases, it's crucial to involve mental health professionals, especially when we notice patterns of excessive concern. We can provide guidance and encourage our patients to seek therapy or counseling.
Yeah, absolutely. I mean, I feel like we are trained to navigate and identify some of these mental disorders, but we are not the true professionals. So we really need to seek out expertise for that. And our psychiatrists, our psychologists, our social workers, they're incredible allies who can help dramatically.
And there's some other ways too, working with their primary care physicians and stuff. There's some cognitive behavioral therapies that are really great. And that helps to retrain their brain around thinking about themselves and other ways that they can do to alleviate their anxieties and refrain from doing harmful things to their appearances.
So what role can we play in the office in a dermatology practice for these types of patients?
Well, I know I have definitely played the role of therapist many a times.
I think Courtney is essentially a therapist. You get free therapy while you're getting your facial.
I cannot tell you how many patients have gotten off my table and said, man, that was better than a therapy session. You get your facial so you feel good, you look good, and then, you get things off your chest. And, what happens in my treatment room stays in the treatment room. It's a very personal experience. And so I think, being mindful of that confidentiality and that vulnerability that people share with you is so important. And kind of heartwarming too. Like I love being there on that other side and helping people talk things out and feel better about how they look and how they feel essentially from that.
And, when they come into our office, we treat everybody like family, but once they've, come in a few times, then they get more comfortable with us, and then they'll really let us know how their feelings are. So we have to have our ears ready to pick up on that and, be able to, gradually let them know that, hey, there might be a little problem here, but you got to do that in a way that isn't very intrusive and it doesn't make them feel belittled or unthought of, because these are real, true concerns, and they're real issues to the patient. So we don't ever want them to think we're dismissing them, and we don't care.
We see people at their most vulnerable selves. I mean, even when you think about just skin checks, we're seeing people undressed. So naturally people feel very vulnerable, exposed. I mean, we're checking it out head to toe. So, being aware that people are coming in there already sometimes with a little bit of anxiety from that, making them feel comfortable and at home and at ease is really important.
And what Heather mentioned, like empathy is so crucial. It's very easy to judge, but really kind of stepping in from the patient's perspective, like they're revealing some really personal details about themselves. And I do think that it's just important to just have them be heard.
Yeah, because they might feel ashamed or embarrassed to bring up those concerns or even talk about their appearance. And so creating that supportive and understanding environment really makes a significant difference as a healthcare provider.
And being able to refer to a professional who is adept at treating a lot of these mental health disorders can be one of the biggest gifts we can give to a patient.
Yeah.
So getting them the help that they need, and just also kind of having them, potentially back down from doing these procedures and seeking out that help, that can be so helpful. But many times they don't have insight into it.
No, they don't. And, so that's when you collaborate with the other mental health therapists. And, we have good doctors, good therapists that we keep in our toolbox that we can, refer these patients to in a kind manner and still keep them as our patients. But for the mental health aspect, we really need to collaborate and, get them the help that they need. Because it's hard. I mean, I struggled with anorexia for years and years and years. And you wouldn't tell now, but it took a long time for me to feel safe and happy in my skin. And, whether it's your size or your color or whatever you have, I mean, you're embarrassed by it and you want to hide it. So when someone points that out to you, that's the last thing you want to hear. And then you just kind of go back in your little turtle shell and you might not ever see them again. So it's, it's important that they get help, but it's also important that we continue to treat them and let them know that, you shouldn't be ashamed of this, that, like you said before, and just remember how deeply it affects them and that we can help them. So we want to offer that help to them. So we have different ways that we can, get them the help that they need.
Yeah, I think that multidisciplinary approach is the most effective way to treat these patients and really to just provide both emotional and physical care. Dermatologists and dermatology providers in general, you think, okay, they're treating the physical aspects of the skin. Well, that's true, but it's not the only thing. We're also, treating that emotional and psychological impact. We'll refer or involve mental health professionals, psychiatrists if we need to.
Yeah, I mean, it's night and day. I even think about, from the medical standpoint, our Accutane patients, for example. And that was one of the things that really drove me to get into aesthetics, was seeing all of these acne patients and their gradual process to clear skin, and just seeing every time they would come back with a bigger and bigger smile on their face. I mean, they just were feeling better about themselves. They were confident in their skin, and that really was encouraging to see. So even on standpoints of things we don't think about, acne, eczema, psoriasis, anything that's visible can still really be impactful.
Yeah, the melasma patients, you can just see, they just kind of sink when they start talking about it. I mean, it really affects their lives.
I know. Our patient recently made me tear up, but she was so excited. She had really bad full face melasma, and she had her daughter there translating with her. And her daughter just said, my mom is so excited to start this journey and be clear. And I was getting emotional.
Yeah.
Yeah. Another unique situation that I've seen that kind of relates to body dysmorphia is not sometimes the actual patient, sometimes it's their partners, their caregivers, parents. And I still remember a case in my practice in New Jersey where she was like 17, coming in, she was coming in for acne, but her mom was asking me about lip filler. And the girl's got beautiful lips. I want to touch it. And she really wasn't that interested, but like the mom was insistent on it. Like to the point where it's uncomfortable. I'm like, she doesn't really need this. And she's like, well, if you're not going to do it, I'm going to find someone else. I'm like, okay, go ahead.
Wow.
Do that.
I actually had a patient at my previous practice. I was seeing the wife, but husband came with her. And, I asked the patient what she was looking for. And before she could even get a word out, the husband says, I just need you to make her look prettier. And I was like, I didn't know what to say.
Oh my God.
Because what do you say to that?
Yeah. You say, get out of the room. She's already looking better.
Yeah.
There are no words for that.
Yeah.
Yeah, I mean, body dysmorphia is one of those, conditions that's really difficult to sometimes identify, even harder to treat. And I think that as healthcare providers, we should just be mindful of, what's going on with our patients' mental health and when to seek help. I think that is one of the most important takeaways from this episode.
And sometimes the patient might not recognize those struggles themselves, and like talking through it might help them realize what's going on.
So I think that this was, an interesting topic to talk about, and a lot of people wouldn't think that it relates necessarily with dermatology, but we see this quite frequently.
Oh, yeah.
Yeah, especially with our cosmetic patients. So I do think that having that partnership with our patients is crucial, having open lines of communication and just being able to refer them to help when needed is so important. All right.
Skin's the biggest organ. I mean, it showcases who we are. And so, I mean, it really affects people's, so you need that well balance, your well-being. It all reflects on the outside. So,
Yeah.
And if people think it's off, then they're completely off.
Yeah, help is definitely out there, whether it's through, therapy, counseling, medications, or simply just having a compassionate conversation with somebody can make a huge difference, and the support you need is available.
So if you like this episode, please follow us, like us, and until next time, Skinside Out.
Thanks for listening. This episode of Skinside Out is complete. If you enjoyed today's episode, don't forget to subscribe, rate, and leave a review wherever you listen to your podcasts. For more tips, updates, and behind-the-scenes content, be sure to see what fun we're up to on TikTok. Follow us on Instagram and Facebook at Nor Dermatology and Aesthetics. Check us out online at norderm.com. Discover why our patients give us 5 stars on Google. Call us today at 919-617-0717.